I'm Tim Bradner. Welcome to Capital Views. Karen Rehfeld, State Budget Director, is with us. And Karen, I was going to ask you what the drivers are in the operating budget. There's great concern this year over the overall budget, of course, but the operating budget in particular. Every year, incrementally, it seems to increase. Very difficult to control. What's driving it? Why is it so hard to control it or to stem the growth of the budget?
Well, of course, there's several things within the budget that are significant drivers. Probably the largest one that's occurred over the past several years has to do with our unfunded liability on our public employee pension systems. Beginning in about 2008, we started actually making an annual payment, a direct payment to help pay down that unfunded liability, several $100 million. In the current year, we're talking about a $630 million payment, and that is scheduled to continue to increase annually to over $1 billion until we start paying that down.
At what point would it reach $1 billion?
It depends on,
Roughly.
there's a couple of different, but probably within the next 5 years, depending on which amortization schedule you would follow. So the governor has proposed addressing that in his fiscal year 15 budget, because it is a significant component of our operating budget on an annual basis. We spend about $1 billion, $1.2 billion on education. That's for our public school funding formula and pupil transportation. Our Medicaid budget is over $1 billion, and that includes, of course, federal and state funds, public assistance. So there's some big formula, we call formula or entitled programs in our operating budget that are big cost drivers. And then on the agency side of the equation, where you're really talking about your 14 state agencies and the University of Alaska, you're talking about the people and the resources to get the job done. Within those portions of the budget, you're really talking about salary and benefits, the annual costs of contracts, leases, those kinds of costs that every business has that are really pressuring the budget, particularly in this current revenue environment. So we've looked at and proposed a very lean budget in FY15 on our agency operations with some reductions in that particular area of the budget. We still have some big cost drivers to deal with.
How have those been achieved, Karen? Because I've noticed in some budgets I've seen an increase in the personnel services side of it.
There are a couple things happening in there. For one, across all of our state agencies, we don't provide additional resources on an annual basis for merit increases for staff. So if you have particular individuals that are in what they call a longevity step, you're required as an agency to absorb those costs in your budget. We don't typically fund increases in contract costs either. So departments are really having to look for different ways to manage their increased costs besides just asking for more money from the legislature, because really in this environment, we're looking at changing the way we're doing business, streamlining what we do, making different decisions when positions become vacant due to retirement or other reasons, looking at not filling those, changing the way we deliver service to be more efficient, more effective, and have it cost less.
Now, I noticed that there is a proposal to eliminate some positions that are vacant, and how is that a budget savings?
Well, it can be a budget savings because typically we don't fully fund personal services in a department. You don't expect all your positions to be full all at the same time. So we don't fully fund those personal services lines. And what happens is departments use a position, they might keep it vacant, and they might use that funding to help pay for another position. When we delete a position and the funding that goes along with it, it puts more pressure on those departments' budgets, and they're going to have to seek more efficiencies and other ways of delivering that service. So it's yet another way for us to continue to rein in spending on the operating side, where so much of your costs are really in your personal services. At the same time, we have some very important things that we need to get done that the public expects us to deliver. So our departments are working very hard and have worked very hard on this budget to bring it in and be able to actually deliver what they're supposed to within the resources available to them.
Now, in the case of the formula programs, these are programs that are locked, where the increases in the way the money is spent is locked in by statute. So this is difficult to change.
It is. It doesn't mean that changes couldn't be made to the statute, and I know that of course, on some of the big programs, like Medicaid, for example, you're looking at the eligibility for Medicaid and the number of people who are eligible, and then the costs of actually providing those services. So to make reductions in what we're actually paying for Medicaid would require a whole host of changes, including changes in healthcare delivery, what our models look like, costs of doing business, eligibility. Those would be significant issues that I know the Healthcare Commission, the legislature, the department are looking very carefully at.
And you could also point to the fact that our Medicaid program here is different than other states, where we operate it differently. So Medicaid in Alaska is not the same as Medicaid in Arkansas.
Well, I don't know enough about Medicaid in Arkansas or other states, but I do know that our state, every state has made decisions about what's covered, who's covered, what services we provide through our Medicaid program.
And these are Alaska decisions.
That's correct.
Yeah. Well, Karen, thank you for being with us.
Thank you.
I'm Tim Bradner. Thank you for joining us.